We're in Amsterdam at the most recent ESPGHAN conference. It's the most important European meeting on pediatric gastroenterology and nutrition. Included in the programs was a symposium about feeding soya products to young children. The chairman was Professor Van den Plas, who has recently published a meta-analysis on the safety of soya consumption in young children.
The main outcomes was very simple, that soy is safe. At least what we mainly focused is on the safety of soy infant formula for infants, and soy infant formula was shown to be very safe for infants.
Some concern has been expressed recently about a number of specific topics, hence the question of what the effect of soya is on the reproductive and endocrine system in children. The meta-analysis gave us some clear answers.
For the reproductive and endocrine system, the findings were the same as for the other parameters. It was very safe. No side effects in infants are reported. In fact, side effects that are reported are only in animals when you inject it intravenously, which has nothing to do with the daily clinical situation of ingesting some soy milk.
Also, some questions have been raised about the increased levels of phytoestrogens in children consuming soya. The study brought clarity to that subject too.
If you measure phytoestrogens in the blood, they are higher than with mother's milk or with cow's milk-based infant formula, but never any clinical effect of these higher levels has been reported. Here the only side effects which are reported is if you inject pure phytoestrogens intravenously in animals, you get negative side effects, but it has never been reported in infants and young children. The take-home message of the meta-analysis is that soy is very safe and that soy can be considered as part of healthy eating habits for infants and toddlers. I think that soy can be safely used from 1 year onwards, and that it is part of a normal diversified diet. There is no reason to not use soy in the diet of a 1-year-old child.
This is Dr. Messina, a world authority in the area of health benefits of soya foods. In his opinion, it's becoming increasingly clear that the proteins in soya are high quality and deserve a place in nutrition of young children.
The soybean has a higher amount of protein than other commonly consumed beans or legumes, and the quality of soy protein is higher than all other plant proteins, and it's actually similar in quality to animal protein. Soy protein is very well digested, roughly between 95 and 100%, and it has an excellent amino acid pattern. So it meets all of the requirements for the essential amino acids, or the indispensable amino acids.
Patients frequently regard soya as just one of the many plant-based food products, but the question is whether we can simply lump them all together.
In terms of protein quality, there definitely is a difference between soy and the other plant proteins. So soy is considered to be a complete protein because if you consume the amount of soy recommended by the RDA, you will get all of your essential amino acids, whereas in the case of other plant proteins, that's not true. Now, of course, you can combine plant proteins and come up with a high-quality protein, but soy protein is a high-quality protein in and of itself. Well, the take-home message is really that soy foods can fit into an overall healthy diet. You don't want to focus on one food too much, but soy is a food that warrants a larger role in Western diets. So I recommend that children consume at least 1 serving per day and perhaps 1 to 2 servings. And it's easy to incorporate soy into the diet because there are so many soy foods that are now readily available.
A third speaker at the symposium was Professor Badger, author of the Beginning Study. This is an ongoing study of about 100 children. They're being monitored from birth to puberty. The aim being to monitor the development in terms of growth of children who were fed with milk, soya, or were breastfed in their first year of life. At the moment, the results up to 5 years have been published, And in Professor Badger's opinion, they all point in the same direction.
I think that soy formula is an outstanding alternative to breastfeeding. We promote breastfeeding as the primary nutrition for infants, but most of mothers feed their children formula in the United States, and soy formula is clearly an outstanding alternative to that. One of the main questions that people ask is soy formula safe? And thus far, we've found that soy formula is extremely safe. So we have studied this issue related to the potential estrogenicity of soy and find no evidence that soy produces any estrogenic effects. That's one of the reasons that we're going to also study these children all the way through puberty.
In Professor Badger's opinion, this new data is very much in line with existing studies. The study looks at the performance of 8-year-olds who, as young children, had either been breastfed or not. A study with clear conclusions.
Children who are 8 years old and who were either breastfed or formula fed as infants and were studied at age 8 years perform at least the same. I think the take-home message is that soy formula is an outstanding alternative to breastfeeding. It promotes a very healthy growth profile. The body composition, which is extremely important in very young kids, is actually superior to formula fed in our mind. That is, the children are leaner, bone structure is healthier, and fat composition is lower. And growth characteristics are very good. So we think that that's an excellent alternative.